Chronic pancreatitis is a chronic long-term inflammation of the pancreas. Usually it happens because of multiple acute attacks to the pancreas. There are so many reasons for that. Most common reason is alcohol consumption. Smoking can cause that. Some rare genetic disorders can cause that. Obstructive pattern can cause that. Some metabolic problem can enhance it, like high triglyceride level. Every time you have an attack on pancreas causes acute pancreatitis, and multiple attacks during the time will cause irreversible effect on the pancreas, like inflammation and fibrosis. And pancreas will lose its function and its anatomical features. Chronic pancreatitis has multiple symptoms. The most common symptom is chronic pain, especially after eating fatty food, but even sometimes without any food, you can have this pain. People usually complain about this epigastric pain for a long time. The other sign and symptoms are functional symptoms. Pancreas has two main functions, exocrine and endocrine. It creates two different type of enzymes that help body digesting food, and it controls blood glucose level. The exocrine function helps digesting food. When the pancreas, when you have chronic pancreatitis, you start having failure in the pancreas function, so you cannot digest food, and you start losing weight, and you have fat in your stool, which is supposed to stay in the body. You start losing that. The second problem, of course, is the problems like diabetes, because you cannot probably make enough insulin. People who consume alcohol usually are the highest susceptible people for that. Every time you consume alcohol, you have some effect on your pancreas, and alcoholics who consume lots of alcohol, they're higher risk of having chronic pancreatitis. People who have uncontrolled high triglyceride level, people with some rare genetic disorders, it's not that common, but it can happen, and people with gallstones. People who their gallbladder makes a stone, they have higher risk of this stone dropping down this biliary system and blocking the pancreas duct and causing the pancreatitis. And during the time, it causes chronic pancreatitis. There are different treatment options depending on the severity and type of effect that chronic pancreatitis has on pancreas. Usually we start it with medical treatment, like giving the enzymes that pancreas is missing. Like if you have diabetes, we give insulin. If the enzymes that help digesting food is missing, we can give those enzymes and follow up and see how much they help. But people who have chronic pancreatitis with severe pain, sometimes these medical treatments, of course, are not working. For the surgical treatment, for people especially who have pain or obstructive symptoms, there are different type of surgical treatment depending on the effect of chronic pancreatitis on pancreas. If chronic pancreatitis is causing the duct inside the pancreas being dilated and obstructed, we can do something is called drainage procedure, meaning opening up this tube to the intestine directly. So it helps removing this pressure. Sometimes it helps with the pain, and of course the function, some function may come back. Sometimes chronic pancreatitis causes severe inflammation and calcification and fibrosis, and the duct is completely collapsed. So drainage procedure doesn't work on these patients. On these patients, we can do resection, meaning we remove that part of pancreas that is severely inflamed and is not functional. That also can help with pain. And sometimes it helps to gain the function of rest of pancreas back. Drainage procedure, as it sounds like it, is helpful when you have some level of obstructive pattern in the pancreas. The obstructive pattern can happen because of long-term having stone inside the ducting system, or this chronic inflammation causes some part of pancreas duct being completely collapsed and the rest of duct becomes dilated. So draining this part will be helpful. So what we do is we bring a part of intestine, a small intestine, close to the pancreas. We open this dilated duct and we make an anastomosis and connection between this intestine and the pancreas duct. So the pancreas enzymes, instead of going to their normal pathway that now is blocked, they directly drain into the intestine. It takes the pressure off the pancreas, and if pancreas is still making enzymes, it can get back to your gastrointestinal tract and help you with digesting the food. Different group of people will benefit from different type of surgery, depending on the type of surgery. People who have had endoscopic procedures and putting a stent inside their pancreas duct, and putting the stent has helped them with their symptoms, are the best candidate for drainage procedures. People who have had a complete obstruction of part of their pancreas and the part of pancreas is not functioning anymore and having constant pain, they are good candidates for resection of part of pancreas that is not functioning. And there is another type of treatment for people who have chronic pancreatitis. Their pancreas is not functioning anymore, their duct is not dilated, and they do not have diabetes, meaning their endocrine part of pancreas is still functional. They're a great candidate for another procedure that is called total pancreatectomy and auto islet transplantation. That's a different procedure that we can offer to them. Depending on the type of procedure, sometimes we do some of these procedures minimally invasive, meaning laparoscopic or robotic. Sometimes we do them open, depending on the patient. Minimally invasive procedures usually have shorter recovery, few days in the hospital, maybe a week or two of weakness and fatigue and not having a great appetite after surgery. But usually after 2-3 weeks, patients start feeling much better and going back to almost normal life. And 6 to 8 weeks usually is the longest period of recovery. For the open procedure, the early part of recovery might be a little longer. Instead of 2-3 days, might be 5-6 days. But still, that's how the recovery pattern goes. There are so many reasons for that. We are one of the busiest centers in the area and even in the country. We offer all different type of procedures in pancreas disorders, from malignant to benign, chronic pancreatitis. And since we are a very busy center, we do all of these procedures so often that brings our rate of complication much lower. We offer different type, including open procedure, minimally invasive procedure, including robotic or laparoscopic, which makes the recovery post-surgery much faster. Also, we are a transplant institute. So aside from these procedures, we offer transplantation, including pancreas transplantation, which first makes us much more comfortable doing more complex procedures, especially when the vasculature is involved or disorder is much more complex than just a simple chronic pancreatitis. Also, on some people who can benefit from pancreas transplant, we offer pancreas transplantation. So I think we are one of the best centers we can offer this.